Today is February 18th, 2021. The time is 6:16 p.m. This is a special meeting of the Southampton School Committee called for 6:15 p.m. We have a quorum with 3 members present. The other 2 members are en route and should join us by the bottom half of the hour. We can start the discussion. The only item on the agenda tonight is a review of the COVID-19 data and circumstances for possible change in learning model. Michael, do you want to go over the hot off the press numbers that you sent out?
Yes, sure. I'll start with the graphs, and I don't know if you can see them both there, but basically the state is doing better. There's a 22% decrease in the last 2 weeks in the number of cases. Hampshire County is not doing better. Hampshire County had a 14.3% increase in the last 2 weeks, and 60% of that was due to Amherst. So Northampton, Easthampton, Westfield, the neighbors are all doing better. The other districts in our group are also doing better. So the context is pretty positive. And I'll show you the actual report here instead. If I can do that quickly. And I know families have not been sent this yet, although Taffy may have done it in the last minute or two. But I was just able to get this report done about 20 minutes ago. And she, even though she's not working this week, was going to send it out through the email system to families. So anyway, you can see more detailed information here. In Southampton, in the last week, there were 18 new cases. There were 29 new cases in the week prior to that. So I think in the last 7 days, Southampton's done better than in the last 2 weeks. The cases grew from 44 2 weeks ago to 47. So 3 additional over the last 2 weeks compared to the 2 weeks prior. The average daily incident rate's now at 55.8, up from 52.5 a week ago. And the percent positive is at 6.7, up slightly from 6.3. So in terms of kind of a macro level view of the situation, things are not moving in the wrong direction as they were a week ago, and they're pretty much plateaued compared to last week. So for me, just looking at large scale metrics, I would still want to stay the course with the remote learning and hybrid learning mostly the way we have it. And as usual, Stephanie's got information about within the in-school environment for all of the districts, but particularly Southampton, if you want to do that next.
Sure. Thanks, Michael. So over the past week, Hampshire Regional, Westhampton Elementary, Williamsburg, and New Hingham have not had any confirmed cases that we have been made aware of. At NORRIS, we did communicate earlier this week on February 16th about a confirmed positive individual in the NORRIS school community. This individual had been in the school building while they were potentially infectious. However, they were strictly adhering to physical distancing protocols, and in collaboration with the Board of Health, identified that there would be no close contacts from their time in the building. Just to follow up on some older cases, we had previously shared that there were 2 confirmed positive cases on February 10th. Both of these individuals continue to be isolated, and one of those cases resulted in 17 individuals being identified as close contacts. I did note this in the previous report, but just didn't want it to get lost this week that, not all of these close contacts were exposed to the positive person in school. Some of it did happen outside of school, but they were members of the NORRIS school community, so we did include them in that total of 17. As of this afternoon, 15 of them have been cleared by the Board of Health, and 2 individuals remain quarantined and are being followed. And then there was still 1 lingering last week from the February 8th case, and we can confidently say now that there was no evidence of transmission from that case. Just to look at NORRIS a little more closely, we currently have 3 individuals in isolation. So those are the confirmed positive individuals, remain isolated. We have 6 close contacts that are quarantined, and so that's, the 2 related to the case that was in school, as well as others that were exposed to somebody outside of the school, just in the community. We have 3 symptomatic individuals that are either deciding not to test and will need to be out for 10 days from the onset of their symptoms, or we are awaiting receipt of their reported negative test. And I can let Eliza elaborate if things have changed, but as of right now, we do not believe that we have any staffing concerns for returning to hybrid on Monday.
Correct.
Stephanie, I have a question, if you can clarify.
Sure.
How is it that, could you give us an example of how somebody could be in the school, be positive, and not have a single close contact?
Yeah, if they are consistently maintaining 6 feet of distance from everybody that they have to interact with. And, even if they are sort of briefly, coming within that 6 feet distance to truly be a close contact, there needs to be greater than 15 minutes within 6 feet. And that's even cumulative. So, we're looking over a 24-hour period. And so, they might say, I was within 6 feet of this individual for 5 minutes. We had a 5-minute conversation, and, we would kind of push further, think about the rest of the day. Is there any chance you had that close of contact with that individual at another time, and kind of, probe for those details to see if, I think too, if we are even getting close to the 15 minutes, we've been erring on the side of caution and calling it a close contact. So essentially this individual did not spend 15 minutes within 6 feet of someone over their time there.
Nobody else? Eliza, do you have anything you want to add or share?
No, I think that everybody's been following the protocols that we have set forth, and I think that we're doing a good job. I don't know what next week will hold with, I don't know if we're past the Super Bowl thing or not, but I think we're, with vacations, we have people traveling. I did reach out to any families, excuse me, that I heard or that we were told were traveling, to make sure they fill out the mass.gov travel form that we've sent out previously, and to let us know, and to get tested before coming back or to quarantine. So we don't know what we're up for next week, but.
Okay,
Can I ask a question?
go ahead, Austin.
So Stephanie, have you guys identified any cases where there was transmission within NORRIS?
We have not. The only positive case where a close contact ultimately tested positive was the sibling of that individual. Yeah. So it was definitely household transmission and not at the school.
Yeah. It's kind of impossible to prevent transmission in the home.
Yeah. And just to throw out there too, I am planning to send to all district families this weekend just sort of a reminder: if you've traveled, here's what you need to do. If your child is experiencing any of these symptoms, they need to stay home, and here's what you need to do. And just kind of, run through my broken record message again that never never hurts to get out there.
And then, so my other question would be, and anybody can answer this, whoever wants to, but the one case that we had that had 17 close contacts, a portion of that was outside, if I heard correctly, a portion of that 17 close contacts was outside the school. Of that number, how many were inside the school or happened because of inside the school?
I would have to look more closely at our case management sheet, but I want to say that 3 of them were from basically a learning pod on their days outside of school.
So that would say 14 of the close contacts happened within the school.
Yes, and it was no more than a handful. I would have to look back at our notes to give you an exact number, but if I'm remembering correctly, I want to say it was only a few of them. The majority were in school.
Okay.
That's correct.
And without going into the details or specifics that would, divulge too much, was there an assessment done afterwards to say, regardless of what we did, there's nothing else that we could have done, we still would have had as many close contacts? Or are we 6 months away from starting all this, that maybe a couple rules get lackadaisical and we just have to refocus? Was there any sort of assessment done?
Yeah, I feel comfortable telling you that it was a younger age group. So, I think that definitely played into just the inability to constantly be socially distanced. I think it definitely reminds us, though, that we need to, in all grades and all ages, just continuously reinforce those practices. Okay.
I think it's just important that when there's double-digit numbers like that we just reinforce the fact that you guys did what you did. You looked at it and said, could we have done something different? And I realize there's a huge difference between a pre-K and a 6th grader, as far as abilities and all that. But
sure. And I think this is a case that's another example where, when identifying close contacts, the contact tracer definitely erred on the side of caution and may have said some were, when in reality they didn't hit that 15 minutes, but with recess time and kind of the inability to have a, stopwatch tracker on everyone involved, just didn't want to not pick a student that maybe was the one that needed to be chosen. It was really hard, I think, in some instances through the day to determine if it did a lot to a full 15 minutes or not. And so they kind of decided to just be more cautious and identified more individuals than might have truly met that criteria.
And this can be an example of where there's a big difference between a consecutive 15 minutes and cumulative 15 minutes, right? So it's not like they're all sharing one carpet square for 15 minutes, but just that they're moving in and out of each other's bubbles, and it just happens to add up.
Exactly.
Other questions on this so far from any committee member?
So from that group of the most recent, sorry, I was late, a couple minutes late. So we've gotten most of the people cleared, and there's just 2 more awaiting, but we don't know if there's any community any transmission as a result of that contact.
Yeah, we're just waiting on final 2. And once we have information on those 2 individuals, we'll be able to answer that question.
Okay, so that whole group will be back. Okay. All right, thank you.
Of course.
Okay, if we're ready to shift gears. Yes. So we have a few minutes and it's COVID related. So I'd like to have a general dialogue right now, see where it goes, but to kind of help us next Tuesday when we meet in our regular meeting. And this way, Stephanie, perhaps you don't have to attend next Tuesday's meeting and get an evening free. But DESI or CDC updated busing regulations. And I know the superintendent sent out some information for us. I don't know if anybody has any specific questions or that. I will say this, that procedurally, we can't change, the NORRIS busing can't change without a vote of the school committee, since we voted the distance. We voted the 2-mile radius. I believe the windows in that doesn't need school committee approval, unless the committee disagrees with me, which is fine. But as the conversation goes, I know, for example, they said you can put, 72 kids in the bus to full capacity, versus we're at the 23% mark right now. So things to think about that are on the agenda for Tuesday night, that if you guys have questions in your mind that you want to ask, now would be a good time.
So one of the questions that I had, as far as like the windows and such, I feel comfortable leaving that up to the administration to decide inches and things based on the DESI policy, but I wasn't sure what you guys thought about that. I mean, I don't feel like I have to put a vote forward or like say what I think about it. I feel like we could just leave it up to them to decide how to interpret that policy.
Well, it also seems like we can't have, if the buses serve the entire district, one decision here may be different than another school, right? So it probably all has to be held at that higher level for everybody, right? Because it would be really hard to change between different schools if it's all the same buses, which I believe it is. Our buses go to Hampshire Regional and...
But that's it. Yeah, it's just us in the regional. Go ahead, Michael. Sorry.
I appreciate your mentioning that, Julianne. It's conceivable it could be done differently, but it would be, it would be hard for the drivers and the company to make that change in the middle of the morning, but to remember to make that change and so on. But that came up when we were talking about handling extremely cold, like below zero temperatures, and there was the possibility that one district wanted to handle that different than the others. So I think the bus company, if we felt strongly, or you all felt strongly that you were going to differentiate, I think they would do it for us, but it would not be particularly desirable to have that occur.
And the current the current guidance that says 2 inches, is that I saw a communication earlier, I don't know, from somebody else, that they didn't think 2 inches was even a measure. It was either 1.5 inches or 3 inches on the buses.
Oh, the click of the window, right? You got to put it in one of the troughs.
Yeah.
And I think the first one is about 1.5 inches down. So that's probably correct. The next one, it may be about 3. So there may not be a 2-inch opening. So, yeah.
So hearing no pushback as far as this, I think the committee is comfortable with leaving how many windows are open and what the spacing is to the administration, knowing that the administration is going to do something that's in compliance with current guidelines.
I'm very comfortable with that. I trust them completely, especially with the guidelines being fleshed out now from the state.
Okay. I think again, I'm not ready to do this tonight, but I'd like to see if we are thinking about moving the radius from 2 miles to 1.75 miles to 1.5 miles to 1.25 miles. I don't know that we can go all the way back down to 0, which is where we were before this year started. But I'd probably be looking for, at least for my vote, I'd be looking for feedback on what a suggestion was. Stay the course, stay at the 2 mile radius for busing and only handle appeals, or go down by some amount, and how many children does that trigger, and what's everyone's comfort level on that before we just do away with the whole thing at once. But I'd like to discuss it Tuesday night.
I would also like, sorry, Michael, go ahead.
I don't want to speak for Eliza directly, but if you want, I understand you're asking for a recommendation about, and probably the numbers, like what do we think it would be? How many more would be on the bus at 1.5 miles or 1 versus 2? But I would like to know if you want, in addition to that, information about if we had more students at school every day, what's the likely implication for bus ridership as well, or whether that's not, I don't want to make it too complicated, but I don't know if you're looking for that kind of information as well.
You mean if we expanded the 4-day in person past the 2nd grade?
Yeah.
And we're going to need that information at some point, because that's what our eventual goal is to get everybody back.
Right, but before we do that, we would have to not be 6 feet apart.
Correct, and that's on the agenda for Tuesday.
Yeah, clearly, yep.
One question I have is if we follow the capacity changes, how does contact tracing work for people who ride the bus? Because then they're within 6 feet for more than 15 minutes if their bus rides 15 minutes. So then are we looking at, then we have to look at the bus and do radius contact tracing?
Yep.
Okay.
And they have bus seating charts now.
They do. There are seating charts and assigned seating.
Yep.
I don't know if you guys know this now, but for Tuesday, like how far apart, if there's kids in each seat, each row, but it's like one family per seat, how far are people distanced?
Well, they're right now, they are every seat. So technically they're not 6 feet apart on the bus. One sits by the window, one is by the aisle, the next one is the window, the next one is the aisle, and then it's the opposite on the other side of the bus. So if you're on the aisle seat, you're on the window seat, so that they're that far apart this way, but not in, you know what I mean? It's not 6 feet, which I think is why a lot of families have chosen not to ride the bus. And with us adding 2nd grade 4 days a week beginning on Monday, we were able to get anybody who wanted to ride the bus on the bus without any capacity problems right now.
But we could bring back information like with the configuration the way it is now, there's probably 2 students that are within close proximity, within 6 feet of any one student, right? Is that probably what it is?
I would think so, yeah.
Yeah.
So the contact tracing would be those 2 students, and it just wouldn't be the whole bus, you know?
Right.
We would go
And
by
if
the
we-
seating charts.
Right. And if we collapse that, then obviously that number would grow,
Right.
at least double probably. Yep.
So the 2 things you're looking for would be, what would it look like if we went down to 1.75 miles, 1.5 miles? That I would have to work with the bus company to find out. And then adding 3rd grade 4 days a week. I mean, I can't really predict.
Right.
I can only go by the kids that are riding the bus now, whether they ride the bus for 4 days. Okay.
Well, sorry, Austin. I don't
go.
I don't know that I'm looking for all that data by Tuesday night. I think maybe the initial is understanding that if we're going to entertain any change on the busing as far as the pickups go, within the 2-mile radius, that takes action of the committee. So I guess my first question that I would ask Tuesday night is, what does administration think? Hold the course at 2 miles, or is there something less? And if there's something less, I'd like to understand the reasoning, why you're taking that position. So I guess, Elisa, I want to make sure that we're not sending you on a wild goose chase to do these 17 different what if scenarios.
Right.
I'm thinking between you, Michael, and Stephanie, what's off the bat right now, coming back from February vacation, knowing that it would take a minimum of 5-day notice to the bus company to make a change anyways. Just what's your initial thought based on the guidelines? And it may be that we don't do anything because it's February break and we're coming back, but we should be looking to March 15th. And, maybe by that time, with the windows can be wide open and it's spring in the air and all that stuff. Kind of help point us in a direction somewhere.
I mean, for me, I don't want to add more kids to the bus and go below the radius that we have now, only because I feel like we're safe. We're in a safe place right now with the number of kids that are on the bus. And if we add more kids, that's just more kids that are going to have to go out if we have a positive case. And then we're going to be looking at it as, is there transmission on the bus, or because they're not 6 feet apart, we're doing, like I had explained,
Right.
But
And there's no other pending appeals, correct? Everyone that's followed an appeal to get on the bus has been heard and a decision's been made one way or the other?
I have one that I added to the spreadsheet that we can talk about on Tuesday, which I don't think is going to be a problem because this person lives at the same address as someone else who was already approved.
Gotcha.
So it's kind of I feel like, how do we say no? But that's all. That's the last one. I didn't receive any others.
Well, I think that's a good barometer on for parents that would put their children back on the bus, right? We created the appeal process, and everyone that applied so far has been granted.
Right.
And we've been able to do it. So just my thoughts. Austin, did I cut you off?
I was just going to ask if we have it's been a long time since I saw the visual, like the chart of what the current seating structure is. So I don't know if there's an easy way to, I can just look in my email for the old one, but if there are any, I know that Elisa, you were speaking to your recommendations, but if you are recommending a change, if we could also see that visually, like what that would look like, that might be easier for me at least to understand what you're talking about, so I can know how to proceed.
Okay. I wasn't recommending a change though, right?
Correct.
Yeah, but if anyone does, just like what would that look like?
I thought you were talking to me.
Yeah, you don't. I'm not saying recommend one way or another. I'm just saying if.
Yes, right.
If.
Makes sense. Yes, got it. Thank you.
Does the administration guide any or offer any guidance to the bus company on if weather's severe. I see here in the document, it mentions that the bus companies should develop a plan for keeping students dry in rainy conditions. Like if there's precipitation that's significant, that may count as an adverse weather issue where the window may not be 3 inches, or if it's downpouring, or if, what happens when weather's severe?
What I would like to do would be what we did one day where we had that happen when it was about 0 degrees and about 25 with the wind chill below. We had them, do we have them close the windows or no, or just to one notch?
Right.
I would like to, but going forward, I'd like to follow their guidance now, which is, Desi says, having every other window closed so that one's at 2 inches, the next one's closed, 2 inches closed, 2 inches closed. So that's what I would recommend we do for, below 5 degrees. And the bus company's prepared to do that if, unless a school committee doesn't want to do that. In terms of rain, we have not done anything to this point to close windows for rain. And we have not handed out ponchos or anything like that. And I have not heard through principals any feedback about that going poorly so far.
Okay.
I might have missed this because I was late, but is there a way to find out how much that first notch is? I mean, 1.5 inches, if that's only 1.5 inches, I mean, that's really not far off. I would rather it be 1.5 inches than down to the 3 inches. That's, so maybe we could find that out.
I can ask Heidi tomorrow. In passing, I know she said 1.5 inches to me when we talked about this in October, but I can double check.
Because I'd much rather see 1.5 inches. I mean, I don't know how you guys feel, but 1.5 inches than all the way down to the 3.
Yeah, and if you look at those air turnover studies, that would certainly be a lot more air turnover than a classroom at 1.5 inches. Yeah. Okay.
Anything else? Next week, we have our regular scheduled meeting, which has been moved to Tuesday to accommodate for the ongoing search committee for the next superintendent. Have we posted that yet, Michael?
Yes.
It is posted. Is it possible to amend the start time to 7 p.m.?
Sure.
Okay.
Well, what day of the week is this? Yes, definitely, we can do that. Yep.
Okay.
You.
And that's it. We can determine, well, we're going to meet next Tuesday for our regular meeting. I'm assuming we're going to still want to hold our COVID update that Thursday. We may not have a quorum for it, but we should probably still meet to just look at the data. I think the following week after that is going to be the key week, because then we'll have the data coming back from February break. So, all right, if there's nothing else to be discussed, we can adjourn the meeting. The time is 6:49 p.m. Okay, I'll take that as a motion.
All right, second.
So moved.
Thank you. All in favor? Aye.
Aye.
See everybody Tuesday night, 7 p.m.
Thank you.
See you there.
Night.
Bye.
Have a
Bye.
good night.